take the nebulization therapy or the inhaler at home, and we have short-acting drugs and long-acting drugs. And whereas the long-acting beta agonists are given for the maintenance therapy, and short-acting are given in the form of nebulizer and that inhalers and respules.
Well, Dr. Raheja, I would like you to tell us a little bit about inhalers also and the right kind of usage of these inhalers. But before that, we have with us Gurdeep Singh from Chandigarh. So, Gurdeep, if you're there with me, welcome to the show.
Yes, good evening, ma'am.
Yeah, please go ahead.
पहले डॉक्टर साहब ने ये बताया है कि एक जो मॉस्किटो कोयल है वो 100 सिगरेट के बराबर उसका लॉस होता है, नुकसान होता है, वो हार्म करती है। तो फिर मॉस्किटो से बचाव के लिए कौन सा डिवाइस यूज करनी चाहिए या कौन सा और कोई ऑइंटमेंट और ऑयल यूज करना चाहिए जैसे कि मॉस्किटो के कटने से बचाव हो सके?
Gurdeep ji, I think you've just thrown a googly our way. So let's see if the doctors can handle it. Yes, Dr. Raheja.
I would like to say that the mosquito coils, they should not be used in a closed environment.
Correct.
First thing, if in the open environment, even that will be washed away with the wind. For the closed environment, there are so many smoke-free options,
That's right.
in the form of electronic devices. I can't name the devices on this show.
Mosquito nets and what have you.
Mosquito nets, there are creams.
And I remember you telling us about medicated mosquito nets.
Medicated mosquito nets can be used.
Yes.
So they are the better way.
Okay, well, so I think let's take on now from where we left. So I would like you to tell us as to how these inhalers should be used correctly.
Yeah, the best form of therapy is the use of inhalers. Because it's a myth that inhalers, once you take, they make you dependent, they are more harmful.
Correct.
I would like to tell the viewers that they are the best form of therapy because you are taking the drug in micrograms. And that too, the drug is going and directly acting on the respiratory airways and lung. And it gives immediate relief, which will last from 6 hours to 24 hours depending on the type of inhaler or the drug you are using in that. There are short acting, there are long acting. And we have found that the commonest cause of the treatment failure in most of the patients is inappropriate use of the inhalers. Most of the patients, they don't know really how to take the inhalers, and that is why I was saying the doctors must advise the patient a plan. And for example, we have an inhaler like this. If it is kept for more than a week time, it should be test fired. It should be just shake it well and then test fire it first. And once you are sure that the medicine is coming out, then the person should hold it like this between thumb and the fingers, and you should just slowly exhale out air from your lungs.
Right.
Once all the air has been exhaled out, you should bring this inhaler between your teeth into the mouth and
just press.
No. Then you have to see that you start breathing from the sides.
Okay.
Slowly start breathing in, and once you have started the breathing process, then you have to give a first dose. Immediately you release it, and you keep breathing deep inside, and then you hold this breath for 10 seconds or more or less, whichever is comfortable to you, and then it is slowly released. And after using one dose, if you have to take the second dose, you should wait for another minute. In case there is a leakage of mist from the sides of the mouth or from the top of this inhaler, you should repeat it. Because then the appropriate medicine may not have gone inside. And after taking the inhaler, it is very important that you maintain a proper oral hygiene by rinsing your mouth. Because the inhalers which contain steroids can cause hoarseness of voice, infection in the mouth, fungal infections they can cause. And the maintenance of these, very important. They should be cleaned once in a week. This is the body of the inhaler which should be separated out. Every week you should put in the warm water. And this container should not be heated because it is pressurized.
Correct.
Okay. Once you keep it in the warm water, just take it out, rinse it with the clean water, then shake dry. Shake it and keep it dry and then put it back.
Right. So, well, I'm so glad that you've mentioned all those important points. But right now, we are joined by Jitendra Kapoor from Delhi. So, Mr. Kapoor, if you are still there with me, welcome to the show.
Thank you.
Yeah, please go ahead.
Hello?
Yes, Mr. Kapoor, I can hear you.
Good evening, doctor. Good evening.
Yeah, good evening to you. Please go ahead.
Beta, I was having an asthmatic problem.
Yes.
The doctor has diagnosed me as sarcoidosis patient.
Okay.
So I just wanted to know the future course of action and advice from the experts.
Okay, thank you very much for your question. And Dr. Menon, आप उनको कुछ बताना चाहेंगे?
Sarcoidosis is a totally different disease. It's